So here's another example of rhinoplasty imaging and how it's actually really important to discuss the changes you're going to make before the surgery with the imaging. So here's an example of someone with a fairly high bridge. So we talked about initially taking the bridge down, and so this is with reduction of the bridge to make it a little straighter. And I think one of the things you notice when you take the bridge down, and if that's all you do, in her case, tends to make the nose look very long, because we haven't actually addressed her nasal tip. So when she came to see me, she was hoping to have the bridge height taken down, and I thought that was a good idea. But I think once I showed her what that might look like, she then realized that maybe we could do something with the tip as well. And so what I had recommended for her was, rather than just go from having a high bridge to a straight bridge, I would actually increase the tilt or rotate up her nasal tip. So when I rotate her nasal tip up, you'll see that it actually tends to make the nose look a little shorter. So this is with the bridge taken down and the tip rotated up, and that looks much more natural. So these are the photos of the actual surgical results. I think this is a good example of how we can predict the surgical results with the imaging, or at least we can give the patients a glimpse into what that's going to look like, so that they can decide what nasal features they want to change and why they're changing those.